Hello everybody and welcome to Friends of Europe's policy debate on Europe's competitiveness, learnings from the healthcare sector. My name is Tamsin Rose and I am your moderator for this afternoon. We have a fantastic panel to discuss this issue and I will introduce them in a little bit, but just to let you know how you can engage with us. We have a vibrant room full of people with great ideas and we also have people who are following us and engaging with us online. So at various points, I'll be opening the floor to engage with you. For those of you here in the room, it's going to be the analog, hands in the air so we can ask questions. And I know for the people online, I have a colleague, David, who is going to be your voice in the room. So when questions are submitted, he will be the one who will bring them into our conversation. For those of you who are on social media, we encourage you to use the hashtag FOEdebate, Friends of Europe Debate, and also New Social Contract. Those are the hashtags we're inviting you to use. So let's start by just framing this conversation. Europe has had a thriving life sciences sector. The life sciences sector has been a powerhouse of our health systems contributing to better population health and to our industrial intellectual property and to our clusters of intellectual thinking at universities. So the life sciences has really been a jewel in Europe's crown, but things have been slipping. We are now in a competition slide against some of our nearest competitors. And just a day or two after the Draghi report put the issue of Europe's competitiveness right on the table and set out very clearly the kind of strategic shift that Europe needs to make in order to guarantee its competitiveness moving forward. We want to discuss today what we can learn from the life sciences and the healthcare sector. What are the lessons it shows in what works, where Europe has strength, what it can do effectively together, but also where the gaps are, where are our failings, where can we do better? So to start us off, I'd like to invite Monica Shaw, who's the Senior Vice President and Head of European Markets at Bristol Myers Squibb. Hello, Monica. So just taking stock of the last 25 years, because I've described at the beginning that healthcare was really an area where Europe could be proud of. We were strong on it. But what's the current level of competitiveness? What's the status of the healthcare industry? And did we take our eyes off the ball?
Hi, Tamsin. Great to be with you here, and thanks for inviting me to yet another event. I think this is a great topic to discuss. So I'm here representing the pharmaceutical industry, but I'm also a doctor by background. I spent 5 years practicing in the NHS, and I'm also a relative. So my father had multiple myeloma, and I was right in the middle of negotiating treatments for him. So with all of those hats, I'm extremely passionate about Europe having a forefront, an advanced seat in life sciences. And in some parts, we've got a lot of reasons to be excited. So innovation in science has never been more rife. There are more new medicines coming through than ever before. And Europe still has a huge part to play. We are a centre of academic research, of investment in R&D. As Bristol Myers Squibb, for example, we have over 2,000 clinical studies ongoing at the moment. But there's a big but, and that is that we are losing ground. The Draghi report was very clear on that, and we can see that as we're making sure we try and keep that place at the forefront of innovation, we really need to understand the environment and the competitive environment that we're operating against. And we can see other regions are starting to sit up and take notice. So recently, Japan increased their RDP, their regulatory data protection, by 2 years. The US, who was always a little bit ahead of us, 20 years ago, they invested $2 billion more than us. The Draghi report now shows that at a time where we're investing $11 billion, the US is investing $44 billion. So it's clear we need to take action, and we need to take action now. We have a lot of great ingredients. We have a lot of common goals to make sure that healthcare is at the forefront of the agenda, but that also the pharmaceutical industry can be seen as an agent of growth for industry and Europe competitiveness. And we have a shared goal around this. And I think as long as we can get around the table and really focus on where we can find common solutions and have that stakeholder partnership, there's a real potential for the future.
Thank you. And just from that perspective, do you have an idea of what would make the EU more attractive to investors? You've highlighted that there is this big gap in terms of the money that's being invested in research and innovation. So what would make Europe a better place for that to happen?
Yeah, so the full ecosystem has to work. So BMS, for example, is a US company. So we make decisions on a regular basis about where are we going to put our clinical studies, where are we going to put our manufacturing plants, where are we going to put our people, infrastructure, and we base those decisions around the favorability of the ecosystem. Now, that doesn't just mean how good a country or a region is at recruiting into clinical trials, but it has to pull through. It has to pull through into access to medicines. You know, it's not good ethics or good business for us to do clinical studies in countries where we know we can't get access. And then through the life cycle of the product, we need to have strong intellectual protection because these drugs are expensive to manufacture. And I would argue that pharmaceutical industry is not only the best, it's the only way that this ecosystem survives. It's now over 2.5 billion to develop a single drug, and that's to develop a drug that works. For every 10,000 molecules that we look at in screening, one will go through. And it's only through supporting this overall IP protection and positive ecosystem that we can really bring this innovation to patients.
Thank you. Let me now bring in Tilly Metz, the Vice Chair of the European Parliament's Subcommittee on Public Health. So, you know, when we're looking at healthcare, of course, we have this issue of the industry and competitiveness, but we also have this issue that it's related to population health, and we need to make sure that we have health systems that can use this and can be sustained. And this, as a policymaker, it's a challenge for you to balance. So let me invite you to think, what lessons would you draw, because you have that responsibility for public health, you're the vice chair of the committee with a responsibility for public health, but we've now got a conversation about, you know, industrial competitiveness. What's the link you would make?
Yeah, first of all, let me say also that I'm very happy that we discuss European competitiveness, and especially also in the healthcare sector. But what I think is very important is really that we have a responsible approach to a competitiveness. I think this is essential to ensure the fully realization also of the European values, such as equity, freedom, democracy, and also human rights. So I am sure that everyone in the meantime has also read or go a little bit through the Draghi report, and I agree on a lot of points with him on the healthcare sector, but also in the industry of decarbonization, for example. But on the other hand, I'm clearly a little bit more skeptical when it comes to an excessive perspective on the market logic in healthcare. Draghi wrote, and on that I agree, that the EU has a general competitive advantage in the form of the European model of healthcare systems that we have, and also the welfare states that we have in the European Union. So it's important that the EU still provides people with a framework that enables them to benefit also from the EU core values that we had. But I'm afraid that by focusing only on ways of making profit or increasing market shares by selling expensive medicine, we a little bit lose what is really the most important and then what really matters for the patients and people in general. So what we need, and you said it, we need really a balanced approach that will keep us to boost the European global standing and to make sure that the system is sustainable and also equitable. Draghi also acknowledged that while the competitive position of the US is better, yes, I admit, than the EU, we have also to look at the social and economic inequalities, and those are growing in the US, and we don't want to end there. I think nobody wants that. So you asked me what is now really important for a policymaker when it comes to competitiveness. Well, first of all, I would like that we really implement what we have and what we have been working and what we have right now. And I'm persuaded, first of all, that we need a paradigm shift in the pharmaceutical research and development approach. What I mean by that, I do believe that the public authority must take a lead really on steering health innovation for the benefit of the public health. So Draghi writes that the EU health research and development funding is lower, yes it is, than in the US, and it was also said by my colleague. And the big competitor now on the ground is also China. They are pouring funds into biomedical research, and they are really improving right now, China, their general position. But most of EU funds come from national level. And what he's writing, also Draghi, that now the funds are a little bit uncoordinated and also fragmented. So in Europe, we do a lot of excellent but small things, and we miss also on the effect of a larger scale. And that is nevertheless important. And that is exactly why, as Greens, we ask also HERA to be more flexible, to be more independent, and to have also more independent funding, and also being able to take more risk in research and to stimulate private investment. It should become like an EU BARDA, but doing even better, because guaranteeing also access conditions, because indeed BARDA fosters a lot research, but without really conditions on the other hand from the side from the pharma industry. So because it cannot be that the public hands is pushing a lot of money in research and development, and then at the end of the production chain pays again a lot in medication. So that's something we need to do even better. And then secondly, I think we need to implement this pharmaceutical legislation that we have right now, because in order to have a framework that guarantees, yes, for the industry, some easier or more efficient way to develop medicines on the one hand, and also we are working on a new mission from the EMA. But lastly, thanks to the Parliament, we have also a disruptive idea that a medication has to be the obligation for the pharma industry to launch a medicine in all countries and all member states. And again, I say that at the beginning, and sorry to repeat myself, it is very important that inequalities should not be widened in Europe regarding access to medicine. On contrary, we have to do our best to make sure patients and everyone enjoy the same access to therapy. And then third point, and I'm going to be very short, of course, and I worked a lot of it on it, is the European health data space. It's also a little bit criticized by Draghi, who is saying it's quite a complex system. Yes, it is, but the EHDS can really be a game changer for Europe, and guaranteeing, of course, respecting data privacy, especially on data which is concerning health, guaranteeing security to the patient. But to be honest, I'm very optimistic that the EHDS in the future can be this game changer without compromising really the interest of the patient. And then let me say just a very, very short point on artificial intelligence. And there I'm also thinking that we have to find also there the right balance in order respecting, again, the rights of the user. But the artificial intelligence, if we do that, if we use it more, it can really help in defining diagnostics, it can really help developing new medicine, and it can really allow more personalized medicine and treatment. So there's a lot of potential indeed. I do also believe that it's not the solution for everything, but there is a lot of potential, and it's paramount also to remember and to fully implement the EU Artificial Intelligence Act. But Draghi speaks even of AI and cloud act that we need to have at the European level. So that's mainly my 3 points, is really finish the revision of the legislation, a paradigm shift in the research and development, and really implement the European health data space, which has, in my eyes, with the artificial intelligence, a lot of potential. Thank you.
Thank you very much, Tilly. And like a good policy maker, you've managed to fit sort of 5 or 6 points into 3. So that's great. Let me now introduce Thomas Heinisch, who is the policy coordinator inside the European Commission's DG for Internal Market, Industry, Entrepreneurship and SMEs. So the last few years have been quite a big wake-up call, the pandemic, and it got the Commission to focus on the entire supply chain, looking at the innovation cycle in a way that perhaps we haven't looked at and scrutinized before. And as we rethink our industrial strategy and our approach moving forward, what lessons have we learned? What have we taken from that whole approach where the Commission said, okay, what's happening here? What are the gaps? How do we manage it? What would you be putting on the table to say, this is what we've learned?
Hello? Yes, thank you very much. Okay, thank you for having me here. Let me start, and I intend to conclude on a positive note. Let me start that the COVID crisis and the subsequent shortages have led to 2 different, let's say, developments. One is the strategic nature of the sector has been officially acknowledged. When you see the different conclusions, council conclusions, and the different papers which have been published over the last, let's say, 3.5 years, 3.5 years, there you see that prior to that, the pharmaceutical industry, or the interest in the pharmaceutical industry or in healthcare industries in general, including, let's say, the medical devices industry, has been rather low. So, with the COVID crisis and the subsequent supply issues, there is a renewed interest, and everybody, I think all decision makers at member states level, at the Commission and the different institutions, is wholeheartedly committed to strengthening the sector as a strategic sector necessary for attaining the political objectives which have been publicly announced. And the other aspect is the supply chain. I mean, coming back to your original question, this is probably the most important lesson we have learned. Many people have underestimated the complexity of the supply chain. With the advent of the COVID crisis, the supply chain became the focus of interest. Not only, I mean, this is not confined to medicines. We're talking about the supply chain affecting different types of products. But I think many people underestimated, as I said, the complexity of the supply chain in the healthcare industry, because there are so many different factors, or so many different factors play a role. You need computer chips for certain things. You need to produce biological materials. All of a sudden, you're running out of a constant supply of certain computer chips, because the computer chips are different from those you produce for other applications, like a mobile phone or whatever. And not necessarily the generation used for the computer chips in these, let's say, machines is the, let's say, the state-of-the-art level, which gets you high prices. So there was a limited interest of companies, or a limited number of companies able to produce those. So all these things came to the forefront. Or think of the sterilization of certain materials, of single-use materials. Who thought about single-use materials? I think nobody. Who thought about the changes in production methods in biological materials, or vaccines in general? Production methods had changed over 20 years. I can tell you, when I was young, the production method for vaccines was different. I was looking for the stainless steel things, you know, and I asked producers, where are those? Oh, we don't do it anymore. Ah, thank you. Okay. So, haven't been to a factory and haven't been exposed to this for quite some years. So, and I think that these are the lessons which are most important. With regard to the competitiveness of the industry, which is linked to the strategic nature, I think a more in-depth analysis is needed. I mean, some aspects were already highlighted in the recent Draghi report. But of course, the devil is in the detail. And here I stop.
Thank you. That's a well-disciplined bureaucrat there. Thank you for that. So we've recognised finally the strategic importance of the healthcare industry, and particularly life sciences, and we've understood the complexity of the supply chain and that it has very specific needs. So interesting learnings. At this point, I'm happy to take a question or contribution from the floor. I've got one hand up, and I'm keeping an eye in case we have something coming in online. Just to let you know, I'll introduce the other two members of my panel because they might answer the question, but they'll speak in a moment. So joining me online, I have Els Toril, who is an independent researcher and advisor on global health equity and medical innovation. And sitting here next to me, I have Andras Tivedar-Kulja, who is a surgeon and a medical professional by background, but is now in the European Parliament and vice chair of the Committee on Environment, Public Health and Food Safety. So they will also contribute to. So yes, madam, if we'll get a microphone. This lady in the green jacket, thank you. Just let us know who you are, please, and then ask your question.
Yes, hello. I'm Maggie Saikali. I represent the European producers of active pharmaceutical ingredients and intermediates. This is the middle of the supply chain, and that's the active part, what makes medicines work. So I want to make a contribution, and then I will ask a question, general question. My contribution is first, Thomas, you mentioned that the Draghi report stopped. Well, we have just published now, it's not yet completely public, but we shared it with the Commission, a study on the competitiveness gap of the pharmaceutical industry in Europe compared to other world areas. And what you just said perfectly echoes this. So we've lost in Europe in the last 10 to 15 years. We went from a dominant market position to one which is still active and healthy, but we've lost about 20% of market share to the sole benefit of India and China. It's not only China, it's also India, and India is very present at the end of the supply chain.
Yes.
What is the cause of the competitiveness gap? Mainly, well, MEP Metz mentioned it, social, meaning that we have our way of life in Europe that entails a certain level of environmental and social protection.
Right.
And yet, we are very happy to source elsewhere in the world where social protection, worker protection is absolutely not ensured, and we just turn a blind eye to it. This is something that we have to face. Moreover, somebody else mentioned it, the level of investment and support to the industry is completely different. Europe, the US, and India have, and China have exactly the same goal, strategic autonomy for the pharma industry. Yet we put less than $1 billion, I mean it's $500 million, on the table. India has $3 billion to support its industry with the same plan. So my question is, first of all, can we just face the hypocrisy of having our standards but not minding where we buy elsewhere in the world and the social and environmental consequences? And the second question I have, do we have the means for our ambition as a strategic autonomy? Thank you very much.
Thank you. So there's a question which is saying, you know, are we matching our ambition with the resources that we're putting into it? And then also, you know, are we being consistent with our values, with looking the other way when it comes to our supply chain? Now, Tilly, I'm going to come to you because this is clearly an issue that I think you feel passionate about, but any member of the panel is welcome to respond on that. Tilly, please go ahead.
Yes. Yeah, thank you for this very, very good question indeed. And let me react to the second part that you mentioned first. I think indeed, it's completely hypocritical if we export our production of active elements into India and China, while going on polluting there and damaging nature and also exploiting people, and not only the people working there, but also the people living in the villages around who are suffering of this enormous pollution. And when I started being member of the European Parliament was July 2018, I had a meeting with an umbrella association of pharma industry, and their first reason not to produce in Europe at that moment, so I'm speaking 2018 or 19 maybe, was clearly the environmental standards. They were very honest with me. They told me that. That was the main reason why they were not producing in Europe. But what we have now, and even if I did not work on this legislation, I think that the due diligence, so that we apply also environmental and human social standards to the products that we import, is revolutionary. Of course, for me as Green, it doesn't go far enough because it concerns mainly very big companies, etc. But nevertheless, it's a paradigm shift. I mentioned this concept already today because I agree with you, it's totally hypocritical if we have in Europe very high standards and then we import and we are destroying. We have only one planet and we are destroying the environment and also the people, exploiting the people elsewhere. So we have to apply the due diligence, so in order that the environment and humans are respected, and we have to apply this mirror, or you can also call it mirror clauses, in order also to protect. I mean, it's a win-win. It's respecting humans, the environment, our planet, but it's also the economy and the competitiveness. Otherwise, with the high standard in Europe and then importing where the standards are not comparable, I mean, then it's also the end of the pharmaceutical industry, or the relocalization that we want to achieve.
Thank you. I know Monica wants to contribute, and I don't know, Els, is this a topic you'd also like to make a comment on? Yes, okay, so I'll go with Monica, and then Els will open the microphone for you.
So I think the good news is that we have really common goals. So we recognize everything you say around health equity. We also want generalized access. We don't want it at the cost of the environment. I think where concern comes in is the law of unintended consequences. And when we look at some pieces of legislation, and I think the EU legislation around the Wastewater Act is a good example of this. 90% of that is being attributed to the pharmaceutical and cosmetic industry. Now, clearly that makes no logical sense when you have detergent companies, other productions happening. And the worry is that while we agree on the direction of travel and we want better environmental support, if the pharmaceutical industry is being burdened with the cost of this and we don't actually apply the fairness around polluter pays, there's no incentivization for other industries to clean up their act. And ironically, a lot of the active ingredients in pharmaceutical, by virtue of being active, are the things that end up in the water system. So while we're very happy to do our part, our worry is that increasingly some of the legislation coming through, whether it's this, whether it's the GPL, potentially puts us in a situation where we are looked at disadvantaged compared to other regions, and without delivering the benefits that we all want. So I think the main thing we're asking for is a stake at the table to have these discussions, because we really do have shared goals, but we need to try and find solutions that end up with everybody benefiting.
May I add something?
Very briefly,
yeah.
before I bring in Els.
What I did not mention, but I'm thinking it and I am perceived, if you compare the US and Europe, what is clear also is that we need to do more investment also we need to support the pharma industry in order to achieve these goals. That's very clear. If you compare the US to the Europe, there is a big difference. They are investing much more in the private sector, but it cannot be. Does one say that in English also? A blanco check?
Blank check.
Yeah. So it has to go hand in hand, as I said at the beginning, with also transparency on cost, and also that you don't pay, that the public hand does not pay twice, that you pay enormous in research and development, and then again high medication. So we have to find, and we need to discuss it, and we need to work together with the pharma industry. That's clear. I'm not. Yeah. Yes. I think it's okay.
Thank you. I'm going to bring in Els because you're next on the agenda, and I think it's a really great bridge to what I wanted you to contribute, because you've got many years of experience around medical innovation policies, and particularly a strong advocate for an ecosystem for innovation that prioritizes patients' needs and their benefits, something that Tilly highlighted. And you also have experience of looking at that from a global perspective. So maybe you might want to just comment on what we've been talking about, looking at this entire supply chain of pharmaceuticals and in its holistic perspective, the environmental and social impact of how it operates around the world. And then tell us, what's Europe's role in a better competitive system, and what would, from your perspective, a Europe-wide health industrial strategy look like? Els.
Yeah, thank you so much for the opportunity. Do you hear me well?
Yes, we do.
Oh, but I do hear an echo, so it's a little bit complicated for me. Okay, I'm trying. So yeah, I think the first thing that I want to really emphasize, and it's a little bit in line with what some of you have already said, but I think if we think about innovation and competitiveness in the health sector, we need to focus that in terms of patient and public health benefits. And that is really what I'm missing a little bit in many of the conversations. And this includes also affordable and equitable access. And I hear you all making the comparison with the United States. I lived for 8 years in the United States. I'm Belgian originally. But I don't want to be in the health system in the United States. If you see how, I mean, the United States spends the most on, or invests the most on research and development, maybe it also spends the most in terms of GDP percentage on healthcare. But if you look at the health outcomes in the US, they are at the bottom of all OECD countries. I mean, it's highly unequal. There is medical bankruptcies and all of that. This is not what we want to compare ourselves to. Or actually, we should be very happy in Europe that we do not face those systems. And we should be very careful that in rethinking the competitiveness and the innovation of our health sector, that we do not fall into that trap, as, by the way, the UK is sliding towards. And so I think we need to really focus on what it is that, why do we have a healthcare system? What is competitiveness there? That is competitiveness in terms of health outcomes. So that's the very first important thing I wanted to say. Then also building a little bit on what Mrs. Tilly-Metz has said, what we have is a social contract. And we've had that social contract all along, all the incentives that exist already today, and there are many public subsidies for research and development, a very generous intellectual property and regulatory system, subsidies in education for doctors, the health system, health insurance that pays for a lot of the healthcare, including medicines and vaccines. All of that is part of a social contract. However, what we see is that social contract is getting lost, because what we see today is that the health purpose is getting increasingly squeezed aside because we focus too much on profitability, and we have a highly financialized pharmaceutical ecosystem now that invests a lot of money, but that extracts a lot of money through venture capital, through dividend payments, through stock buyouts, etc., such that actually the investments that really go into R&D that genuinely lead to medical improvements are very limited. And so that social contract, we need to really rebalance that. The other part of the social contract is we have a supply-driven medical innovation system where we as the public, we wait and see whatever it is that the pharmaceutical industry decides to invest in and to put on the market. But do you know that more than half of the new treatments that reach the market nowadays have no added therapeutic value? And that is a very wasteful system. And I want to reinforce what Mrs. Tilly-Metz has said. We need a new ecosystem, a new paradigm around medical innovation for equitable access, addressing the priority health needs, and not whatever the industry thinks is the most profitable. And I want to emphasize here that under the Belgian presidency of the European Union, the last 6 months, there has been a lot of work done to try and put forward a needs-driven priority setting, that we can actually look at what are the priority health needs that we have in a society that we want the pharmaceutical industry together with the public sector to work upon. And one of the elements that I think that we need to put forward in that new social contract that can be taken the form of a new industrial policy is, first of all, have the mission of improving patient health and public health first, And all the rest, and that's like a mission in the words that Mariana Mazzucato would use, put that front and center and then see how can we build collaborations between public and private sector, but such that equitable access to needed innovation affordably can be the result. And I don't think we should compare ourselves to the US nor to China, because the outcomes that we are looking for in terms of public health is not what they are looking for. And that, for me, is the uniqueness of the European project. If we can conserve that part of the social welfare state with good health, but as the right to health, I think that is critical. And I can make one very concrete suggestion. In addition to incentives that prioritize added therapeutic benefits rather than whatever medicine can be profitable, is that we need to invest in a platform, a clinical trial platform, independent, where we can do real public health-driven research, assessing medicines, existing medicines and future medicines, really to maximize its public health value, because that today is really missing, because clinical trials are done by pharmaceutical companies who are only looking at their own product. But what we need from the public health perspective is really to assess how can we best use these innovative products, but for public health, and combine them with each other, look at dose optimizations, repurposing, all these things. But that today is not commercially interesting, is not done, and I think a lot of medical innovation can be done through that, by really innovating for patient benefit rather than only focusing on new molecules or new technologies. We can do so much better if we collectively invest through that clinical trial platform that shouldn't be commercial, but really public health driven. And I think that Europe is in a unique position to do that. So I'll leave it here for now.
Excellent. Thank you very much.
It's music to my ears.
Okay, so Tilly Metz is really, she's taking notes of lots of that. And let me just now pass to the last member of our panel before I open it up, who is also a policymaker, but has a background, like Monica, in the front line of healthcare. So, and you bring all of that experience into your policy making. So what for you are the pathways that we could use to foster research and innovation in Europe? We've heard that, yes, we have different objectives and different outcomes from both China and the US. So perhaps we shouldn't just be automatically comparing ourselves based on the numbers that's invested, but what's your perspective?
Thank you, Tamsin, dear colleagues and dear guests. It's my pleasure to be here and to discuss these very important questions and how we can advance Europe's healthcare sector and safeguard its competitiveness. As a surgeon and also as vice chair of European Parliament's Committee on Environment, Public Health and Food Safety, I witnessed the urgent need for change in our healthcare system. During my medical studies and practice, I saw firsthand the challenging condition in our hospitals, often lacking basic resources, surgical tools, or even soap and paper in our hospitals, Hungary. So these experiences drew me to engage in politics and for advocate for a stronger and more equitable healthcare system across Europe. That's a fact that the EU faces a significant challenges and lacking behind the US and China in research and innovation, fragmented regulations, but I think our healthcare systems in Europe is more accessible for European citizens, and we have to mention it. But as the Draghi report highlighted, there is an annual investment gap of 270 billion euros in EU research and innovation compared to the US. This gap, I think it weakens our competitiveness, particularly in healthcare. And to address this, we need to invest in research research and harmonize our policies and share best practices to prepare our healthcare system for the future. In more detail, yet, we have to increase funding for research and development. I must mention the healthcare workforce shortage is more and more critical in Europe, especially in eastern part of the Europe, and to find no medicines, new therapies, and even screening policy systems is a must, because we must help to our healthcare workers to be more effective, to spend more time with patients and not, for example, bureaucratic or other parts, because this problem is affects in our future, in our healthcare. Even yes, we can find new medicines, but if we don't have the healthcare workers to give the medicine to the patients, what we will do. So, and very important to harmonize and coordinate the regulatory frameworks, harmonize and simplify the regulation across EU member states to reduce the bureaucratic hurdles and accelerate clinical trials and bring innovation to market faster. And different member states have their own regulations and trials, market access, approval of new medicines, resulting in fragmented process and delays in bringing innovations to the market. So I think it's very important to find solutions, and I know that at the EU level, the clinical trial regulation and medical device regulation aim to harmonize these processes, but there is a problem that different EU states at the national level has been inconsistent, resulting in fragmentation and lack of coordination of this field. So therefore, to enhance healthcare innovation in Europe is crucial to ensure that every regulation are not harmonized only in theory, but also consistently applied across member states, aligning national practices with EU directives to create more cohesive and predictable regulatory environment. And just few words about data sharing and secondary data use. We have the GDPR system, and it ensures our data protection and privacy for individuals, and it is very important, but it also can create administrative burdens that slow down the cross-border data sharing and innovation. So it is very important balancing the need for the robust data privacy with flexibility to facilitate innovation is a challenge for the EU, and to maximize our potential, we have to find a solution for this also.
Excellent. Thank you. I mean, you've highlighted some of the major challenges, and of course, as a healthcare professional yourself, you will have really experienced the shortages of healthcare workers and the impact that has. So we've had sort of a whole range of different diagnostics here put on the table about why we need to look at our health sector and within that our healthcare industry a little differently. We've had a couple of questions. I'm getting a message from David Foote. We've had a couple of questions from Slido. So let's hear the messages from our online audience.
Yeah, thank you very much, Tamsin. Just one question from a Slido platform. So what regulatory changes or incentives could accelerate the shift of key supply chain activities back to Europe in the healthcare sector and the pharmaceuticals? This is the question that we got. Thank you very much.
Great, thank you. So again, we're coming back to the conversation that we've been touching on from many different angles, which is investment. Monica, you started us off with, what would make Europe more attractive, and we've heard that it's an issue that we need to support some of our SMEs. We've got loads of new ideas and early researchers coming up but they hit the valley of death and they disappear, and then we get brain drain of young researchers going elsewhere. So tell us from your perspective, we've been asked what regulations or incentives would make it easier more for investment to happen.
Yeah, and if I take a step back, the last time I was practicing medicine, which is, 20 odd years ago now, to be fair, but there were AIDS wards. People were dying of AIDS. If you had a diagnosis of metastatic melanoma, that was it. You had a few months left to live. Fast forward those 20 years, and now, you can be transmission-free with HIV. You can live a long and happy life post-metastatic melanoma. In some places for gene therapy, we can offer cure. I'm extremely proud of being part of an industry that has shaped that way of healthcare has seen. And it requires the whole ecosystem to work. Again, it's over $2.5 billion for an individual medicine, one that actually works to get to market. It requires us to invest in this. It requires us to look at this as a business. And for the whole ecosystem, whether it's regulatory pieces, whether it's access, it requires the whole thing to work. And I hear you that we don't want to have the same healthcare system maybe as US and other markets. That's not what we're looking at when we're talking about competitiveness. What we're looking at is the whole ecosystem. How do we make it attractive for businesses to invest in Europe, to continue not only the innovation in terms of products reaching patients, but also R&D, clinical trials. We do over 2,000 clinical trials across Europe. This is a contribution also to European healthcare. The risk, if we don't take stock, if we don't acknowledge where we're falling behind, is that we will make global decisions. And whether it's supply chain, whether it's investment in R&D, all of these things are linked in a broader ecosystem. And as a European, I want us to have a strong Europe so that we build more manufacturing plants in Europe, so that we run more clinical studies in Europe, and so that more European patients get access to innovations and we start to cure more of these diseases.
Thank you. Now, the question I think was quite interesting because it was looking at this question of, onshoring manufacturing and supply chains. And several of you have spoken about the fact that, the COVID-19 revealed to us we've got complex supply chains. They're very stretched, but they're highly concentrated with certain, particularly I think of China and India, their role in our supply chains. So I'm going to come to you, Thomas, because you were nodding there. Particularly this question about, onshoring, bringing back to Europe some more of our supply chain. What do we need to do from a sort of strategic and policy perspective?
Well, first of all, I'd like to mention the work of the Critical Medicines Alliance, because it offers a unique opportunity to identify the shortcomings, to find compromises among the different people sitting at the table, because we have a diverse, let's say, a diverse composition of the participants. In the past, as I have been in this business for quite some time, because that's why I know quite some faces in this room, we had structured dialogues. They were called differently, but it doesn't matter. So although the remit of that exercise is rather limited, it's still a unique opportunity to exchange and to prioritize activities. So I guess by the end of this year, we'll have a report summarizing the different work streams, because there are so many different subgroups and task forces. I can hardly follow all of these. That finally we have a consolidated approach. And this is then a very, let's say, it's a unique input, a very crucial input to be given to the political masters, because it will then enumerate the different shortcomings and possible solutions. Not all the solutions will actually be practical, but at least we know what has to be done. And the other thing, which is a personal pet of mine, is standardization. During the COVID crisis, we saw that the lack of standardization in the production of biologicals, vaccines, was one of the hurdles. So if there is a shortcoming or a disruption in the supply of a minute single-use item, the whole production can come to a standstill. because this particular site has got all the authorizations based on the submission of data and documents which were not generic, but actually mentioned the name of components, input materials, manufacturing procedures offered by one particular supplier. So there are different ways to overcome it, either by a generic description, but this will not solve the problem. But as far as I've understood, and the lukewarm response from certain suppliers, and I think the producers of medicines, in particular of certain biologicals, should play a leading role. When they plan sites, they should make sure that there are redundancies, and actually they're in the best position to impose on suppliers the, let's say, the wish to standardize certain input material. Because, I mean, for example, you have a car. The wrench to repair a car is the same, whether it's a Peugeot, a BMW, a Porsche, whatever, or a Fiat, doesn't matter. So I know the business model of suppliers, yes, and understand that certain things are patented, yes. But at the same time, we have to have a balance to increase the redundancy of our supply or production chain. Thank you very much.
Thank you. Els, let me invite you to also reflect on that. You know, this question of, you know, if we're looking to strategically onshore back into Europe more of our supply chain, what do you think when we look at it from this perspective of a new industrial approach, what should we bear in mind? What are the pitfalls to avoid?
Yeah, well,
Els.
I think that, oh, sorry.
Yes, go ahead, Els.
You hear me? Yeah. Before I go there, I wanted to react on something that Mrs. Shaw had said. Like, I mean, I'm a biomedical researcher, and I am extremely proud of having contributed these past 20 years, actually including, I was personally involved in the development of a new drug for African sleeping sickness, which is today available in African countries for this fatal disease. But in contrast to the figures that you were mentioning of 2.6 billion for a drug, we spent with the Drugs for Neglected Diseases Initiative less than 100 million to develop that drug and bring it to the patient. So just to say, and we all know that this is a controversial debate and there is a lack of transparency, we're not going to go into that here, but just to say that there are very different calculations about how much it costs, and that this is not really an argument to justify the very high prices that currently are being charged for medicines increasingly. And if we are looking for more investments, because this was actually part of the questions that we have, where can investments in R&D come from in Europe? Well, one element is by paying much less for medicines, because we totally overcharge, companies totally overcharge, and we, taxpayers' money, totally overpay for certainly the new medicines. And if we can find a better and rebalance that social contract where we build public-private partnerships to do the research and the development, but with the goal of equitable and affordable medicines, and that will include reshoring some of the supply chains and indeed paying fair prices and not going for the extractive businesses of trying to source as cheap as possible, but then building a very profitable system. Actually, a fair and transparent, profitable, but not exceedingly profitable system. And I think we cannot deny that there is a high degree of financialization in our whole economy, but also in our healthcare system and the pharmaceutical system that stands in the way today to actually move towards a much more equitable and health-focused system. Thank you.
Thank you, Els. We're coming towards the end of our conversation. I'd like each of our panelists to think of just one or two sentences that you'd like to put on the table to say, we started this conversation by saying we've just had the Draghi report, which has highlighted the strength of Europe's life sciences and its benefits to its healthcare industry. But it highlighted we've got gaps, we need more investment. You on the panel have called for investment with conditions, investment to meet our public health priorities, investments that take into account social and environmental aspects, Colleagues, one sentence each. What would you like to say about this? Yeah, I can see hard faces on the panel. It's tough. Thomas, I'm going to start with you, maybe because you made the face the first.
Thank you. Highly appreciated. So it will be a very long sentence. Okay. As promised, I start on a positive note. So I start with two activities which are already ongoing. One is the important project of common European interest. So there we have two health-related so far. And these projects will focus on the competitiveness of the industry, comma. With regard...
Wait, I'm waiting for the full stop, but yes.
With regard to the supply chain, I already mentioned the Critical Medicines Alliance.
Yes.
And now I turn into the future. There I'd like to make 2 points. One is the Critical Medicines Act. And the other one is revisiting the European procurement rules. So I think these 2 points are of importance, particularly to the pharmaceutical industry. And here I stop. Thank you very much.
Excellent. Monica, please.
So I'm going to take your lead and also start with the positive, which is I think we are in an era of scientific revolution. And I think we very much have common goals when it comes to the root of it. We do need to remember that we operate in a global economy, and it really is only through partnership that we can keep Europe at the forefront of this positive momentum.
Thank you. Els, and then our parliamentarians will leave our policymakers with the last word. But Els, go ahead.
Yeah, very quickly, I think that the one word I want to leave everybody with is equity. That should be the driving force, and anything else, health benefit and equity, anything else should be secondary. And that's the only way in which we will retain our competitive position from a health perspective in Europe.
Thank you. Tilly.
Okay, I try in one sentence. So, in a global chase, we cannot just, and we don't want to duplicate US or China. We have to be better, and more innovative, and also more socially just, while preserving our strongest competitive advantage with a strong and resilient healthcare system and social rights. That is also a competitive advantage. Yeah, I want to add another thing. Well, but I stop here. Except you allow me to say another sentence, which is more a reaction to what was said before.
I think we'll move on because we are really
Okay,
running out
then I
of time.
stop.
And that, please go ahead.
200 years ago, the average lifespan was about 36 years. Now it's more than 80. 100 years ago, the infant mortality rate was 16.5%, 22% in Hungary, now less than 0.7%. It is the result of innovation and hard work in healthcare sector. So we have to keep the innovation, increase the research development to find new solutions, but also supporting the development. We have to ensure the equity in our healthcare system for European citizens.
Thank you, and thank you for leaving us on that note to remind us how far we have all come. I'm sorry we've run out of time, but thank you for your wanting to make a contribution. Just a reminder, several of you spoke about the social contract. I just want to highlight that Friends of Europe put together a report earlier this year on a renewed social contract. And there we've got a number of policy changes that we encourage people to think about, specifically looking at the European nature of what we've been talking about. Europe's healthcare system is unique in the world. We target universal health coverage. Our environmental and social protections are dear to us, but also affect that environment. So some key messages that came out. Yes, absolutely, compare ourselves to other parts of the world, but scratch beneath the surface of some of the sort of crude figures around investment to understand what's it invested in, and is that the same way that we need to address it? Lots of messages coming through saying it's fragmented, we can do better through collaboration, coordination, and at European level, things like approaching the Critical Medicines Alliance, looking at could we streamline our approach to clinical trials, where the European health data space, yes, it's complex, like everything we try to do with 27 countries is complicated, but it could deliver lots of benefits. So I want to say a warm thank you to our panel, to you, the audience, and people joining us online. I'm sorry, we are out of time. So we'll... no, we don't have time for a question. I'm sorry. I'm sorry, we are literally out of time. So I'm going to have to close this, but you're welcome to say something afterwards. So thank you all for joining us. Thank you all, panelists. And we look forward to seeing you at a future event. Thank you.